Hello viewers, I am Dr. Lakshminarayanan, neurosurgeon. I am here to talk to you about epilepsy. As you all know, epilepsy is quite a common problem wherein a patient has involuntary movements of his body with or without loss of consciousness. The commonest idea one would get is of a person lying on the roadside with severe involuntary movements and frothing from the mouth and in an unconscious state. But there are varieties of epilepsy where one need not become unconscious. You can have only involuntary movement of a part of a body or an abnormal involuntary behavior lasting few seconds to a minute, with or without awareness of this happening to the individual person. Though epilepsy, as it is called, is a very, very old disorder in the human race, still lot of myths persist about epilepsy. They border on from the idea that it is a possession by an evil spirit, up to where people think because of his worries and tension, he has got epilepsy. No. Epilepsy is created by a surge of electrical impulses in the brain, commonly due to a chemical imbalance, sometimes due to structural problems or trauma or infection in the brain. The treatment for epilepsy is quite effective. In the last 30-40 years, we have seen a number of excellent medicines which have come to prevent and even cure epilepsy. Wherever the problem of epilepsy is due to a pathological problem, like I said, trauma, infection, tumors, the same should be treated along with anti-epileptic drugs. Wherever there is no identifiable cause for epilepsy, and we say it is idiopathic epilepsy, just treating the patient with adequate medical dosage for about 5 years gives the patient 90% cure rate from epilepsy. The remaining 10%, it takes time. Some of them for another 2-3 years, a few percentage of them is lifelong. One of the earliest cautioning signs of epilepsy is in a child who, even at a temperature of 100, 101, gets an attack of fits. Commonly, temperatures of 105 and above or 106 degrees cause seizures. But here, in this child's brain, which has this little abnormality, a temperature of 101 causes fits. And it is better if this child is investigated and treated accordingly. A lot of centers, they feel a febrile fits need not be treated. One more important question when treating such patients is to ask the family whether the child had fever before the fits came, or you have found fever after the fits has happened. Because of fits, a severe involuntary movement can increase the body temperature by about 2 degrees centigrade easily, and it could be misdiagnosed as febrile fits. There are even surgeries for seizures which are of intractable nature. These are where the patient, in spite of adequate medication, is repeatedly getting seizures. There's many types of surgeries that are performed on a regular basis with good success rates. With these few words, I would like to request all my viewers to approach seizures in a scientific way and not by sentimentals and other thoughts of it being due to, as I said earlier. Thank you once again.